And good morning to all the attendees. My name is Justin Flam. I'm co-chair of the Employment and Labor Relations Group at Taft, and we are pleased to be here this morning with Cintrifuse, presenting with my colleagues Sarah Leishock and Connor Meeks on issues pertaining to the return to the workplace as people try to get back to normal. As the pandemic stabilizes a bit and offices are opening up again, state restrictions on office presence and in-person work are gradually being peeled away. And employers everywhere are confronting the question of what is the right answer for how to get people back into the office. And some employers are also confronting the question of, is it the right answer to get employees back into the office? The phenomenon we've seen over the past 3 months, as people have been working from home in many industries, has really driven a change that a lot of HR folks and employment attorneys think is going to change the workplace in a more long-term kind of way, rather on the longitudinal basis here. I just read a document the other day by Cushman & Wakefield, the global commercial real estate company, and they did a survey on this and found that about 73% of the employees they surveyed are interested in having some different options, including more flexibility to work from home. Cushman & Wakefield is describing this as the total workplace ecosystem, the word they're using for this. And they're also cautioning people along the lines of an issue that I've flagged for a lot of clients is this is not return to work in most cases. Certainly there are some businesses that have not been able to continue their functions, but in many cases it's just been a different kind of work environment as people retreat to their basements, where I am and where I've largely been since March, or home offices or other spaces where they can get work done without being in close contact with people as we're all trying to stay separate. So throughout the course of this presentation, Sarah and Connor are going to walk through many of the legal issues that form the backdrop to all of this. Certainly there are safety issues, compliance issues. Employers everywhere are concerned about liability risks. We'll spend a lot of time talking about those and how to best navigate the potential pitfalls on those fronts. Also, we're hearing from a lot of clients. I'm personally talking with a number of clients about what the right thing is to do and how do they manage their workplace culture and address these kinds of issues that they're hearing from their employees. So I got a lot of clients who just call and say, can you just tell us what the sense is? What are people doing out there? And where do you think the market in general is going? With tech-based businesses in particular, you have more flexibility, at least as an option, to keep people in a remote mode or perhaps a split mode where you have people back in the office at some point and a little more work from home or work from other locations. So employers are wrestling with this, trying to find the right answers, and we're here to help you walk through that and give you some boundaries as far as what the legal issues look like, what best practices look like for safety and related issues as more and more people return to the workplace. With that, I'm going to turn it over. If you have questions along the way, if you look in the chat function on Zoom, I put my email address. I'm going to serve as moderator here. Please email those to me or send them via Zoom chat. And I'll break in here and pose the questions to our presenters as we go forward, but just so they can focus on the material they're covering, I'd ask that you send the comments and questions to me, and then I can field them from there. Thank you. Take it away, guys.
Hi, everybody. I'm Sarah Leishock. I am a labor and employment attorney at Taft with Connor and Justin, and it is our privilege to provide this information to you. We've been on the phone and Zoom calls constantly for the past few months dealing with the unique situations that the COVID pandemic has created for business owners, executives, human resources departments. And so we are seeing a lot of the same questions. We're seeing a lot of the same situations come up, but we're also seeing the laws and the guidance from the administrative bodies, local and federal, at the local and federal levels, just change on probably a weekly basis. So it's important that you stay up to date, keep attending webinars like these, because the information does to some extent either enhance or get stale over time. So thanks for taking the time to join us today. I'm going to talk to you about a variety of considerations for reopening the workplace, or maybe your environment didn't fully shut down over the last few months, but you're considering expanding the size of the workforce over the next few weeks or months in light of recent return to work government directives. So I'm going to go over some of the key considerations for bringing your employees back to the new normal or back to work. And let's start with talking about the recent government directives allowing businesses to expand their operations or return to work. If you work for a company or are involved in a business that has employees in a variety of different locations, it's important to keep in mind that you need to comply with all local orders wherever your employees are located. So if your headquarters is in Ohio or Kentucky or Indiana, you may be most familiar with those government directives as they change and evolve over time. But also keep in mind, if you have employees working in California or New York or perhaps in other jurisdictions throughout the United States, you need to make sure that you're complying with those local government directives as well. As you know, we have the Responsible Restart Ohio program for Ohio businesses. We have the Healthy at Work program for reopening Kentucky businesses. And then Back on Track Indiana, a roadmap to safely reopening Indiana businesses. Those are probably the most relevant for the individuals on this webinar today. So we're going to look at sort of what's involved in those, but keep in mind, even within a particular state, there could be more city or local level initiatives or directives that may be more restrictive than the state directives. So be sure to watch for all relevant jurisdictions, not at just a federal and state level. So the Ohio plan is a lot like most of the other states' plans in terms of there is a phased approach for businesses to reopen. And Ohio's plan makes it very clear that certain types of businesses can reopen on certain dates, as long as those businesses can meet the sector-specific operating or safety requirements that the Ohio order has put in place. So just to give you some examples, manufacturing, distribution, construction, and general office environments were permitted to open in Ohio as early as May 4th, as long as certain minimum precautions were met. Consumer retail services were able to open up on May 12th, and then daycare centers opened up on May 31st. These dates certainly do not suggest that they opened up to the exact same capacity and using the exact same business plan as they had before, but they were able to re-engage their business at a greater level on these dates and in March and April. So we are working towards reopening to a full economy, but certainly these orders, none of the orders in Kentucky, Ohio, or Indiana bring us quite back to the way we were before the pandemic was declared in March. So if you want to get more information, and I encourage you to do that prior to reopening, you're going to want to start at the State of Ohio's coronavirus webpage. That's where you'll get the actual orders allowing for your business to open back up and indicating all the precautions that have to be met for your particular industry. And then just general precautions. These are based on CDC recommendations that you've probably already heard before, but don't minimize the importance of the daily health assessments or self-evaluations of employees, asking them to indicate whether they are experiencing any coronavirus symptoms. The obligation to make sure that your employees are washing their hands and have access to hand washing stations. Employers must enforce social distancing precautions. That's really important. You can't assume that everybody already knows we have to stay away from each other, or that it's a personal decision. It is in fact a condition on remaining open that the employer have social distancing rules and in fact enforce them. And then also sanitizing the physical facilities throughout the day or between shifts. That's a mandatory precaution that all businesses must use if they're going to operate under the Ohio Return to Work Plan. I also want to point out that Ohio has a hotline where both employees or employers or any consumer can call and ask questions about safety precautions that are being taken. Be aware of that, because certainly you as a business owner or a manager can take advantage of that and call to get clarification. But certainly that is not an anonymous hotline. There could be recording or records maintained of that. So in terms of asking questions to help your business, you're probably going to want to direct those to counsel prior than going to the hotline. But be aware that employees have access to this hotline. So if they're not sure about something, this may be a resource that they use, which can in turn result in a visit from the local health department. So Kentucky has a similar plan that's phased based on a business's ability to meet the minimum requirements for that particular sector. Similar sort of dates for bringing construction, manufacturing, and offices back to work. That was May 11th. And again, note here that office-based businesses were allowed to return at a 50% level. So again, we're not going back to exactly the way we were, but we're slowly phasing in to bigger participation. Retail opened up May 20, and childcare programs are going to open up on June 15th. Again, social distancing is required. Masks are required unless the employee is working alone or there's a health and safety risk that prevents them from wearing a mask. Hand sanitizer and hand washing stations must be provided by the employer. They must sanitize the facilities, require temperature checks or health checks on a daily basis for employees. And then in Kentucky, employers are also required to designate a healthy at work officer who's in charge of sort of facilitating any concerns or responding to concerns, communications, and just essentially representing the business in terms of the plan for making it safe. And I think I forgot to mention that in Ohio as well, masks are required. There are, again, some limited exceptions, but employees must wear masks in Ohio unless there's a health and safety reason for not doing so. Kentucky also has an email address where questions can be directed for information about what precautions need to be taken in order to comply with the Kentucky orders. But again, consider referring business questions to your counsel. Indiana has a similar plan. They're calling theirs a staged plan 1 through 5. We're currently in stage 3. That's scheduled to end on June 12th. And at stage 4, they anticipate office and retail being able to be increased to full capacity. So that's a little bit of a different phase. But again, just because the government order says that you can increase to full capacity, that doesn't necessarily mean that's right for your organization. So really keep that in mind in terms of what the local government directive says is permissible within the state does not mean that's where your entity needs to be at all times. In Indiana, your employers are actually required to develop a written plan and implement those measures in the plan to make sure that their work environment is safe. Again, the plan must address things like health screening, enhanced cleaning and hygiene measures for employees, must communicate that face masks are recommended for employees and customers, and the employer must require social distancing within its facilities. And all of these local orders are based primarily on CDC and OSHA guidelines, but there are nuances that are specific to each individual jurisdiction. And that's why it's important that you go to each of these states' coronavirus return to work websites and really read through the orders to get the specific requirements of each jurisdiction. So as I mentioned before, just because the state or local order allows your industry to open back up, that doesn't mean you need to be there right on the very first day. If you're prepared for that and you have a business need for that, then that's great. But I think what's really important is that you take the time in advance to work through all of the potential changes that are going to need to be made. Think through the personnel scenarios that you're going to experience so that when you do open up and bring employees back, that you're doing so in a prepared manner that keeps everyone safe and healthy and also mitigates any potential employment law risk. So the first advice that we have for employers who are working through the reopening question is don't move too fast. Take the time to really think through everything. It doesn't mean that just because you can return up to 50% or up to 100% of your workforce that you in fact need to do that. Think about your business needs. Think about whether your employees have been equally productive, satisfactorily productive or unproductive in terms of their ability to work from home, and make decisions based on that. And of course, it's not a all or nothing scenario, but different sectors of your workforce may be more or less productive based on whether they're working remotely or they need to be in the work environment. But certainly think through that with your coronavirus response team or your reopening response team, and think through what groups need to come back first and which groups could continue to support your organization just as productively by continuing to work remotely. And then you'll want to bring back your essential employees first. So those who cannot work effectively from home or from a remote location, those who perform those essential job functions that can't be done away from the work environment, those should have the highest priority for being returned to work. And you may actually think of it in terms of, as you think through what precautions or what modifications need to be made to the work environment, it may be easier to do it for a smaller subset first. And so this is a good phased approach for your business as well, just like they're doing for all businesses within a state. So consider this phased approach for your workforce. Different types of phased approaches work for different types of organizations. So it depends on the nature of your business, your operating model, the product or service that you provide. And obviously you're going to want to bring back those who are producing and cannot produce from home first. But you may consider within that group of employees allowing only those who want to return first. So offering a return to work on a voluntary basis will help avoid any potential risk for those who don't feel comfortable or are unable to return to work. You may also consider changing up the scheduling that you've previously used, staggering shifts, to allow more employees to come back to work, but perhaps still minimizing their in-person interaction with each other or the number of different individuals who are in the workplace at one time. And then you certainly would need to think about which employees need to be in the physical work environment in order to support your employees in the essential sectors. So your support and your administration may need to be there as well. You'll obviously want to try to minimize the number of people in the work environment as possible. So you'll work with a skeleton staff, but consider maybe even having like a skeleton staff A and a skeleton staff B, again, to try to minimize the number of people who are there, but provide as much coverage on as many shifts as you have based on the modified scheduling. So you're going to have to get creative in terms of scheduling, in terms of minimizing the number of employees that you bring into the work environment at one time, in terms of being able to have the support needed to sanitize and provide the personal protective equipment in the work environment. That's going to stretch your staff thin. So think about what your organization can do in terms of making it safe. How much support do you have? And then be very, very clear with your employees about your expectations. If you are accepting voluntary employees but not requiring those who are not comfortable returning, let your employees know that's the decision and the rationale for that decision. It's so important to be clear about the precautions that you're taking, the reasons that you're taking it, the health officials' advice that you're following in order to keep your employees safe. Having this type of clear communication with your employees as you begin to ramp up or actually go back to work, it's important that employees feel safe. The more safe they feel about coming back to work, the more productive they're going to be, and certainly the less personnel or employment law issues you're going to face, because they're going to feel confident that all reasonable precautions are being taken by the employer and that they're working in a safe environment. If you have employees who have concerns about whether you're really buying into their safety or really doing everything that you can do to protect their safety, they're going to be less likely to want to return to work. So we are seeing employers having to change the way they do business. I mean, we are having to change the way we do business. There are certain things that we've done in the past, with regularity that just don't fit right now in light of the coronavirus precautions that need to be taken. So at this point, even when employees return to work to produce or to perform their job duties in person, it's still essential that employers eliminate all unnecessary in-person meetings. So all of these precautions on this slide here, I suggest that you have a policy or some sort of written communication that lets employees know that you need to minimize all unnecessary in-person meetings. So we may all be exhausted from all of the time we spend on Zoom or Teams or other WebEx type platforms, but that's sort of where we are right now. So it's important that you let employees know that in-person meetings will be minimized, whether that's with external contacts or even internal contacts, to the extent that the communication can happen over web chat. That's an important priority for keeping people safe. Restricting third-party visits into the office or the work environment, that should be minimized as well. Kind of falls under the first tip here. If the communication can in fact be as productive or nearly just as productive as a phone call or a web chat, that needs to happen rather than an in-person contact. Employers need to restrict all unnecessary business travel. Employers should not be sending employees out into different environments or jurisdictions where the prevalence of COVID could be higher, or perhaps a governmental directive could change and the employee could be stranded somewhere. It's important that for the time being, when we are taking such strict COVID precautions, that employers not require or allow any unnecessary business travel. And then finally, social distancing policies. Certainly that's a word that months ago it meant, or a phrase that months ago meant nothing to us, and now it feels like we're saying it, multiple times an hour, every hour. But it's very important that employers implement social distancing policies, communicate them to employees, and enforce them, because this is the key precaution for preventing the transmission of COVID. So before you go back, think about how you're going to handle certain types of employees or employee situations that are very likely to come up because of the coronavirus. So first and foremost, we have many employees who are impacted by school and childcare closures. So this was certainly a big issue in March when school was still in session, but a lot has changed. A lot of childcare facilities have had to close down and may or may not be reopening right away. So employees will definitely face a lot of situations where they're unable to return to work, or they're late for work because of sudden childcare issues. And we'll talk about in a few minutes the Families First Coronavirus Response Act, which gives employees paid leave for circumstances like this, but you need to think through what you're going to do when that leave is exhausted. How are you going to treat employees who are unable to work for this reason? It's very likely to happen, and it's important, however you decide to handle it, that you handle it consistently to avoid a discrimination claim. You also need to think about your employees who depend on public transportation to get to work. Public transportation is obviously a high-risk area for contracting COVID. You're interacting with a lot of people. There's not great ventilation on a lot of the buses, trains. So you need to think about, if you have employees, some or a good majority of employees who depend on public transportation, is there anything that you can do to accommodate those employees to allow them to perhaps arrange for alternate transportation, or maybe even take public transportation, but in a not as busy time frame? So think about maybe a shift schedule or offering an incentive to employees that would allow them to either have reduced parking costs or maybe even rideshare programs. And then we're seeing a lot of questions about employees who are at a higher risk for developing a severe illness as a result of COVID. And employers tend to know this information about their employee for a variety of reasons. Maybe they've taken leave before, maybe the employee volunteers it. But the CDC did come out recently and identify that employees who are, or I'm sorry, older adults who are over age 65 or people who have serious underlying medical conditions are certainly at a greater risk for developing a severe case of COVID or complications. And some of these underlying medical conditions that make people a higher risk are chronic lung disease, severe asthma, serious heart conditions, when they're immunocompromised, if you have severe obesity, chronic kidney disease, or liver disease, and these are just some. We also have employers who are concerned about pregnant employees because we are just not sure what the impact of the coronavirus could be on the carrying mother or the baby. And so we have a lot of employers who, with good intentions, have concerns about their employees' health. And so the CDC, if you go to their website, they'll say that they encourage employers to be supportive and to encourage options to telework for these employees if that's available. And they also encourage employers to give those employees duties that minimize their contact with customers and other employees. And while I think those are great ideas, I just want to caution you that you do have an obligation under the Americans with Disabilities Act not to make any decision that is adverse to an employee because of their disability. So you need to be really cautious about complying with the ADA when you're dealing with those individuals who may have an underlying condition that puts them at a higher risk for developing a serious COVID reaction. The EEOC, hang on just a second. So employers ask us, what do I do if we have an employee who has one of these serious health conditions? Well, the EEOC came out with guidelines to help respond to COVID-related situations. And in short, under the Americans with Disabilities Act, employers cannot ask disability-related questions or make medical-related inquiries unless the employee poses a direct threat to the health and safety, or unless the employee is asking for a reasonable accommodation because of their disability. So unless the employee brings it up first, employers cannot prohibit these employees with disabilities from coming into the work environment. It's also important to note that the EEOC came out in, I think it was in March, and said that the coronavirus pandemic is such a threat to the health and safety of the work environment if an employee with COVID or COVID symptoms was in the work environment, that it is okay for employers to make health-related inquiries to determine if the employee has COVID. So that means employers can take the temperatures of their employees and can make reasonable health screening questions or have employees indicate if they have any symptoms of COVID before they come into the work environment. Now, it's important to remember those types of inquiries are considered medical information, and they must be treated as a confidential medical record and maintained separate from the employee's personnel file and treated as confidential at all times. So it's important that we respect that information, but the EEOC does support employers gathering that. Also keep in mind that you're balancing a fine line here between not approaching someone affirmatively who you believe may have a health condition that would qualify them for a reasonable accommodation versus responding to a request for an accommodation. If an employee with a serious health condition, like those the CDC lists as high risk, asks for an accommodation, you then have an obligation to engage in the interactive process to determine what precautions or what reasonable accommodations need to be made so that the work environment is safe for that particular employee. And in accordance with the CDC's recommendations, working remotely is a preferred approach. It's not the only approach, but it's something to consider if at all possible. So another situation that you need to think about is if you have laid off employees, like many businesses have done, you may need to start recalling those employees to come back to work. And it's very likely that you're not going to recall 100% of those whom were laid off. you need to first think about your business needs, which sectors of your workforce need to come back first, and then how many within that group do you need to bring back. It's important that you use documented criteria for selecting which employees will come back to work in order to avoid a discrimination charge. So it's really important that you're using objective job-related criteria and not some other factor. You also want to examine and make sure that you're not creating any unintentional disparate impact on a particular protected class. So you want to make sure that you're not inviting all the men back to work and not the women within a group, or a protected race versus another race. So make sure you're being conscientious of that potential appearance of discriminatory intent, but also make sure that you're documenting the criteria and following that documented criteria as you begin calling employees back. So you may want to use something like seniority or shift basis, but also think about, do you need to make any modifications to someone's previous shift to make sure that everyone's getting an equal opportunity to come back to work. The last item to think about in terms of recalling your employees is you need to make sure when you bring employees back that you're reprocessing them correctly. That's correctly according to the law, and that's also correctly according to your policy. So you may need to look at whether an employee was terminated and is being rehired, or perhaps they were only temporarily laid off with a reasonable expectation that they're going to come back to work. There may be different requirements in terms of whether they need to complete a new application, whether you may need to get a new background check, certainly with regard to whether you need to have them complete a new I-9 or just simply follow the I-9 rehiring process. But pay careful attention to how long an employee was laid off and the circumstances of that layoff to make sure that when you bring them back, you're following all legal and policy required procedures. So we are actually seeing a lot of employers have situations where an employee refuses to come back to work. And there are quite a few laws sort of at play here that I want you to keep in mind. Certainly if an employee is refusing to come back to work because they have concerns about the safety of the work environment, the analysis usually turns on whether their concerns are objective and reasonable and certainly in good faith. So under the National Labor Relations Act, employees have the right to engage in collective protective activity and to oppose or discuss or take certain actions in response to the terms and conditions of their employment. So if they're concerned about having an unsafe work environment to return to in a group, or two employees are talking or discussing the issue or refusing to gather, you may have an NLRB issue or NLRA issue to think through, and certainly you'll want to bring counsel into that situation to make sure it's handled correctly to avoid an NLRB charge. Also, you need to think about whether the employee who's refusing to come back to work is refusing for a reason that would be considered covered leave under the Families First Coronavirus Response Act. So you may be able to invite someone back to work, but immediately place them on leave. I know that seems a little unwieldy, but you're not, it is illegal to make decisions relating to their employment that are adverse because they have a need for leave. So if someone fits your objective criteria and you invite them back to work, but they immediately need to use their 2 or 12 weeks or some portion thereof of their FFCRA leave, you still need to allow them to do that. The upside of doing that is it sort of gets the clock ticking on the exhaustion of their leave. But just keep in mind that you cannot not invite them back simply because they're going to have an FFCRA covered need for leave. And then also, as we discussed under the ADA, you cannot refuse to invite someone back simply because you know that they have an underlying health condition, or because you're going to need to engage in the interactive process to accommodate an underlying disability. Those would all be prohibited reasons for choosing one employee over another, and be conscientious of those parameters when you are putting in place a plan bringing some but not all of your workforce back. And then also there's unemployment considerations. We have a lot of employers who are saying to us, hey, our employees don't want to come back because they're getting paid more in unemployment, or they just are enjoying the time at home and they'd rather continue to collect unemployment. And while certainly the unemployment programs vary from state to state, typically an employee is not eligible to continue to receive unemployment benefits if they refuse suitable work. So again, the analysis turns to whether the employee's refusal is objective and reasonable and in good faith. When you do bring an employee back to work, you are going to need to be really conscientious of their need, which could change over time, but their need and availability for leave for coronavirus-related reasons. But remember, there could be reasons that are not related to the coronavirus. So first and foremost, the Families First Coronavirus Response Act that was issued in response to this pandemic does provide emergency paid sick leave and emergency paid family medical leave for certain coronavirus-related reasons. And that's paid leave under a federal law that's never been provided before. So you need to make sure that you've familiarized yourself with the provisions of this new law, and make sure that you have a policy or procedures in place to comply with it, and that you've communicated the availability of this leave to your employees. In a minute, I'll go through all of the covered reasons for that leave, but keep that in mind. You're going to see a lot of that, and that's not something that employees will necessarily take all at once. They may take small portions over time, but for the next several months to many months, we will see employees be impacted by coronavirus in a variety of different ways, whether it's illness, childcare, taking care of an ill family member. And so employers generally need to be a bit more flexible, and this law helps facilitate that flexibility. Also keep in mind that employees are still entitled to the Family and Medical Leave Act leave, which provides a variety of covered leaves, but most importantly, leave that is unpaid for the employee's serious health condition. So this is entirely unrelated to coronavirus, a broken leg, cancer treatment, those types of things. Employees are still eligible for that FMLA leave, even though it may have a significant impact on the employer's ability to operate. You need to make sure you're still complying with your FMLA obligations. Also, employees can take FMLA leave in order to care for a family member with a serious health condition, so keep that in mind as well. Also, make sure you're still enforcing and allowing employees to take any company-provided leave, maybe that's PTO, sick time, short-term disability. All of that stacks on top of the FFCRA. The FFCRA is not in lieu of that. So be conscientious about providing that leave to employees as well. And then most importantly, make sure that you're not retaliating or taking any adverse action or avoiding selecting an employee to return to work because of an actual or anticipated need for the employee to take leave. So real quickly, I have a list of the Families First Coronavirus Response Act covered reasons for paid leave. So generally, employees are entitled to 2 weeks of leave for any of these reasons listed here, except for that fourth reason, which is a child care related reason. Employees are entitled to a total of 12 weeks of leave, and that includes any leave that they've taken under the FMLA. So employees get up to 2 weeks of leave if they're quarantined pursuant to a government order or the advice of a healthcare provider for coronavirus related reasons. This is all coronavirus related. They're also entitled to up to 2 weeks, and again, it's 2 weeks for any of these reasons, if they're experiencing symptoms of coronavirus and seeking medical diagnosis. And that applies even if they get a coronavirus test and it comes back negative. That time off that they needed because they had symptoms and were seeking medical diagnosis, that's still covered by the FFCRA, and they're still entitled to paid leave for that time. They get paid leave if they are needed to care for an individual who's quarantined pursuant to a government order or a healthcare provider's advice. They are entitled to paid leave if they are needed to care for their child whose school or care provider is closed or unavailable, again, for COVID-related reasons. And remember, this type of leave grants the employee is entitled to a total of 12 weeks. The other reasons it's just 2 weeks. And then we have this random category at the end here that's included in the law. Employees are entitled to up to 2 weeks if they're experiencing a substantially similar condition specified by the Secretary of Health and Human Services, but that there's not been any circumstances specified here, so that's kind of just a placeholder for the time being. So when you're thinking about what procedures or what modifications to the work environment or business operations need to be implemented before you can bring your employees back to make the work environment safe, you need to make sure that you are specifically addressing coronavirus and that you've implemented and you're prepared to enforce infection control practices. So look at the CDC's website. They have lots of specific guidance, industry specific. Look at the local, state, and city government directives to determine what you need to do based on your industry. And then you need to think a little bit more specific to your particular work environment and what changes need to be made so that your employees can social distance, so that your employees can have more space, so that your employees can be prepared with the personal protective equipment that's needed to minimize the risk of transmitting COVID. So think through that. Then it's so important that you communicate to employees all of those safety precautions that you're taking, all of the safety precautions that you expect them to comply with, and also provide them with the protocols or the information or the PPE that they need in order to comply with those precautions. So that could be everything from putting up signage, supplying masks, giving them hand sanitizer, putting up those clear barriers that you're seeing everywhere, marking the floor with masking tape, reminders to stay 6 feet apart, but you physically have to provide that information and the protocol so that they can see it on a regular basis, and that will help with enforcement. And then I think most importantly, or just as important as the regular thorough communication, provide a training on coronavirus return to work precautions. Let employees know specifically how the work environment has been modified for them, and actually have them, whether it's online or in person or in a web chat, make sure that they attend and you keep a record that they attended that training as well. So as I mentioned before, the EEOC did issue guidance indicating that employers can test employees or make health-related inquiries relating to the coronavirus to make sure that no one with symptoms or the virus itself enter the workplace. So think about whether your work environment is one that it would be appropriate to either test employees before they come in when testing becomes more widely available, or whether they need to, or whether it makes sense to do questionnaire or daily screenings. But keep in mind that the tests must be accurate and reliable, so they can't be based on stereotypes or ask for irrelevant information that doesn't help determine whether an employee poses a coronavirus-related risk to the environment. Think about whether you will request or require employees who are entering the physical workplace to self-monitor for coronavirus symptoms and report any. Most employers are requiring that employees sign a certification on a daily basis, whether it's digital or paper form, to indicate that they have self-monitored and they do not have any symptoms. And we think that's a great idea. Again, keep in mind though, that must be treated as a confidential medical record and isolated from other personnel documents and maintained confidentially. So not provided to other employees who don't have a coronavirus related business reason to know. And then make sure that employees know that if they do have any of these symptoms that you're screening for or that indicate that they could have the coronavirus, make sure that they know that they are to immediately notify their supervisor of that fact and go home. Employees should not remain in the workplace if they have any symptoms. And then, as I mentioned before, make sure you're keeping all of this information about their symptoms, their potential, a potential diagnosis or a suspected diagnosis. Make sure all of that remains confidential in a separate file. That includes when you're taking employee temperatures. Some work environments, particularly those where it's difficult to consistently keep at least a 6-foot social distance, it may be appropriate to take temperatures of employees before they come in every day. There's a variety of different options. You could have an employee sign a certification saying that they tested themselves at home. You could provide them with a mechanism to take their own temperature in the workplace. You can have that. You can have a station where they can take their own temperature and report that to employees who are overseeing the temperature taking process. But be sure to notify employees in advance if you're going to be taking the temperatures at work, or if you're going to be requiring a temperature reading certification. It certainly feels like an invasion of privacy or could be off-putting if employees are not prepared to physically undergo a temperature taking experience when they come into work. So make sure that that's something that's communicated clearly in advance and employees are able to provide any feedback or concerns that they have. And then also make sure that if you do have a temperature taking station set up in your workplace, that there's appropriate precautions at that station to make sure that the employees who are supervising that are not being potentially exposed or unnecessarily exposed to other employees. So make sure that you've really looked into what types of physical modifications, obviously mask wearing, physical barriers, the most the best type of temperature taking equipment that can be justified, on your company's budget and size of the work environment. So make sure you're using the best equipment there. And then again, make sure that all the employees who are operating the workstation and going through to get their temperatures taken know that if they have an elevated temperature above 100.4, they must go home. Employers are asking us what to do if someone has coronavirus symptoms like the cough, sore throat, sudden loss of taste or smell, fever, and what rights do they have to send an employee home? Well, absolutely, you have 100% right to send the employee home immediately, and you should and must do that to protect the health and safety of the other employees around your workforce. So you want to ask the employee who has those symptoms after they've gone home or after they've been isolated from the rest of the workforce, who they've had close contact with over the past 48 hours prior to experiencing symptoms. And that's because CDC has come out and made clear that within that 48-hour period, the virus, before experiencing symptoms, the virus can still be transmitted to others. So get a list so that you can do appropriate contact tracing, and then decide whether an employee who has symptoms prior to a diagnosis will be required to quarantine at home or simply self-monitor, and additional precautions can be taken to allow the employee to return to work. I think when in doubt, the employer should always err on the safe side and require the employee to quarantine until a diagnosis has been made. And if the employee has the coronavirus, obviously they need to stay home until they're symptom-free, in accordance with the CDC guidance and instructions of their doctor. But if they get a negative result, then the issue becomes, whether the symptoms continue in a way that would make them a continued threat to the health and safety, or whether that threat can be mitigated with additional precautions like a mask. So think through that issue. Also, you'll have to immediately make sure that their work environment both common areas and their particular workspace is sanitized. And then you need to report the confirmed case to the local health department. And the ADA, the EEOC has come out with guidance that says it's not a violation of the ADA to provide the name to the local health department. But keep in mind when you're notifying other employees in the work environment that they may have been potentially exposed, that you do not provide the name. It's important that you maintain that employee's confidentiality. The name is not necessary to protect those other employees who were potentially exposed, so you do not provide that. So social distancing considerations, as I said earlier, we've heard that word a million times. We're probably sick of hearing it, but that does not mean that it's not one of the most important considerations for the employer to think through when they're talking about returning their employees to work and then monitoring the safety of the work environment after employees come back. So think through your work environment and figure out what needs to change physically or strategically in order for your employees to maintain a safe and healthy social distance from each other. It definitely means doing things differently. And so it's important that employers get on board and realize that we're not going to be able to do things the same way. We're going to have to make changes. So that might mean a new layout in the work environment. It might mean putting up physical barriers between workstations, but we're definitely going to have to do things different. And so I don't think you should think of it in terms of, you know, what's the one thing I can do, but instead it's what is everything that I can do to make this as safe as I can possibly make it. And then consider changing employees' work times or their schedules, again, to minimize the physical interaction, but also minimize the number of employees who are using the common spaces in between each cleaning. Think about ways that you can improve your ventilation within the work environment, and then also consider whether you are required by your local jurisdiction to have your employees or customers or visitors use face masks, but it's strongly encouraged, even if the law doesn't require it. It is the best way, in addition to social distancing, to minimize the transmission of COVID. And then again, do not underestimate the importance of hand washing. We've certainly had a lot of time to think and joke about, you know, hey, I'm a grown-up, I know how to wash my hands, but it's absolutely important that employees be given the opportunity to wash their hands, certainly much more frequently than they would have before. So many environments have a 4 hours on, small break, 4 hours on work day. And it's important that you think about whether you need to modify that to allow employees to wash their hands anytime they sneeze, anytime they're soiled, anytime they have any concerns. So you may need to have a more flexible break policy or access to hand washing and hand sanitizer policy than you'd had before. And then again, it sounds silly, but encourage employees not to shake hands, fist bump, touch. You would be surprised how many calls we've received thus far saying one employee got mad at another employee because there was some physical contact. So as all of us have been sort of separated in our homes and we return to work, it's important to constantly remind people that we're not returning back to normal. And it's easy to forget that we still need to, you know, stay 6 feet apart from each other, not hug, not touch, not shake hands, even though we're retraining sort of the way we act in the work environment, or retraining ourselves the way we act in a professional setting. It's important that we remind each other not to shake hands, even though that's something that we've done, obviously, as a matter of courtesy before. Make sure that your work environment has lots of cleaning supplies in common areas and workstations. This is more than what you would have had before. Certainly, it feels a little awkward, but everyone needs to know that you know, washing your hands and then touching a door handle immediately afterwards sort of defeats the purpose that is so important right now, that we not share spaces and come in contact with high touch areas, not touch our face, that type of thing. And so putting those supplies around gives everyone the opportunity to make sure that they feel safe and that they can use those supplies whenever they feel like they may come in contact with a high touch area. And so that certainly would involve increasing the number of hand sanitizing stations that are available in your common areas. So I think what's really important for you to take away from my portion of the presentation today is that you think through all of these issues. You put a plan in place, working with a team to help support your work environment, and then you communicate these important decisions, the important rationales for the decisions, and the expectations for employees going forward. When you provide that type of communication, not just once, but on an ongoing basis, you're going to not just provide a safer and healthier work environment, but you're going to have employees that feel safer and healthier. And that's really important in terms of mitigating your employment risk and retaining your workforce so your business can be successful. So I will now turn this over to Connor, who is going to talk to us about OSHA-specific guidance.
Thanks, Sarah. Hi, everybody. My name is Connor Meeks. I'm also in our Cincinnati office at Taft, and I practice in labor and employment and do a good deal of occupational safety and health work as well. And for many of you, OSHA compliance may not be or hasn't been in the forefront of your mind with a lot of your operations, and that you may not be in the manufacturing sector, and just not traditionally in hazardous environments. But now we all find ourselves in a situation where there are new workplace hazards that are in many cases just out of our control because of the presence of the global viral pandemic. And so the Occupational Safety and Health Administration, in conjunction with the CDC, has come out with several enforcement guidance and interpretive guidance of what the regulated industry should do. Now, OSHA has, in many cases, taken some heat from the labor side of the regulated community for not having a specific standard for infectious disease and pandemic preparedness and response. And there have been calls to the Department of Labor to engage in rulemaking to address this particular issue. To date, there has not been any activity within the Department of Labor to issue a notice of proposed rulemaking or to come out with a new standard. Instead, OSHA and many approved state programs like Indiana OSHA have said that they will rely on the general duty clause in many cases to enforce the requirements for employers to implement precautions and procedures to protect employees. And then there are other standards that I've listed here that may apply tangentially to certain aspects of those precautions that are being recommended by OSHA and the CDC and other agencies. Now, the general duty clause, what that means is that every employer is obligated under the Occupational Safety and Health Act to provide a workplace free of recognized hazards. And in order for OSHA to come in and say that an employer failed to do so, there has to be employees that are exposed to a serious hazard, meaning one capable of causing serious injury or death, and that it is a hazard recognized in the industry for which there are feasible methods to mitigate the hazard. So to break that down a little bit, I think everybody can agree that the pandemic and the virus is a recognized hazard. I mean, the World Health Organization has declared a pandemic, and everybody understands the risks. So the hazard itself is recognized, and it's obviously one that's capable of causing a serious illness or a fatality. So what that leaves then for OSHA to prove is, did the employer, were there feasible methods to mitigate the hazard, and did the employer take those steps? And so what we're seeing then is, the CDC coming out with rolling waves of updated guidance as we learn more and more about the virus, and OSHA sort of piggybacking off of that guidance. And as Sarah's gone through, many of the precautions and things that employers are being advised to do for employees, as well as just society at large, there are clearly feasible methods to mitigate the hazard that the Occupational Safety and Health Administration, the CDC, state agencies, state governments, that everybody feels are feasible methods of mitigation. So to the extent that you don't implement things as simple as social distancing, wearing masks in states that require it, or even in states that don't require it, but that it's viewed by OSHA as something that's advisable. Hand washing. So to the extent that you don't do those things, OSHA could come in and issue citations under the general duty clause saying that this is a recognized hazard, and the CDC and the world for that matter believes that this is how you mitigate it. So To not do those things could open you up to enforcement risk in ways that you've never experienced before, because now all of a sudden we've got these hazards in the workplace that didn't used to be present. And so in responding to some of those hazards, there are other compliance issues that come up that you've probably never encountered before. And I've listed some of those here and these other standards that could apply. So depending on the types of PPE that you might adopt in your workplace, eye and face protection, respiratory protection in the way of face masks, whether you're using N95s, which are considered by OSHA to be respirators that require several compliance measures under a written respiratory protection program, or if you're using loose-fitting face coverings like a surgical mask or a cloth face covering, those don't have the same compliance requirements as respirators do. So depending on what you are requiring employees to wear, or even if it's voluntary instead of mandatory, there are things that you need to keep in mind potentially that you would have to do to meet OSHA requirements. If you have folks in the office that are doing sanitization practices using disinfectants and chemicals that didn't used to be present in your workplace, you may have obligations under OSHA's hazard communication standard to train employees about how to read the labels on the chemicals. If chemicals are being transferred into temporary spray bottles, those have to be labeled. You have to maintain a database of safety data sheets for those chemicals. So there are things to keep in mind. It's not, you can't just let people loose with hazardous chemicals that they don't quite understand the risks of without first training them on those risks and documenting your training. In the event that an employee were ever to complain about these new practices, and OSHA has been flooded with employee complaints related to coronavirus hazards, and I'll get into in a minute how OSHA is responding to those complaints and what level of risk you run of actually having an investigation. But it's important to keep in mind that you do potentially have new compliance requirements that were never present in your workplace before as a result of the virus. Sarah discussed a little bit about taking employee temperatures and doing health screening and some of the records that would be generated as a result of that. You may have documentation retention requirements under OSHA's medical and exposure records at 1910-1020. So another thing to keep in mind as far as documentation and keeping medical records separate from the employee personnel files. And then injury and illness record keeping and reporting. If you have employees who become a confirmed case, it may be a recordable illness on what is called an OSHA 300 log, which depending on your industry or how many employees you have, you may not have ever kept these before. If you have less than 10 employees, you don't have to keep an OSHA 300 log unless OSHA specifically asks you to do so. Or if you're in a low hazard industry, you may not be required to keep OSHA records. But if an employee does contract the virus, becomes infected, even if you're not required to keep OSHA's records, if that person were later to become hospitalized or die as a result of the virus, that's something that would have to be reported to OSHA. You have to call them or submit a written report online to let them know of the event of a hospitalization or a fatality. So keep in mind that if you do have an employee who's infected, you may have record keeping obligations and then potentially reporting obligations if unfortunately the employee's condition worsens. Next slide, please. So in early April, OSHA came out with its initial interim enforcement response plan for COVID-19 related workplace hazards with respect to employees filing complaints or calling OSHA and complaining about. In many cases, what we were seeing is the complaints were, my employer's not an essential business, but they're still forcing me to come to work and I feel unsafe. They're not doing this or that. In a lot of cases, it was employers not being able to procure face masks because there was such a run on supply when the pandemic first began. And as the manufacturing community caught up and people, the supply of masks became more widely available, those complaints sort of died down. But area offices were flooded at the outset of this with complaints from employees. And so they came out with this interim enforcement response plan and basically said that unless you're in a high or very high risk job or workplace, such as some of these examples, like first responders, hospitals that are treating patients with COVID, biomedical laboratories are dealing with, bodies, for example, of processing somebody who died. Those are the types of high or very high risk jobs that OSHA would focus on. And even then, they were very opposed to doing on-site investigations unless absolutely necessary, meaning there's many complaints of hazardous conditions in the work environment, employers not following social distancing or not providing PPE. Unless there were complaints of imminent hazards like that, or fatalities occurring as a result of the virus in a particular workplace, area offices were instructed to use rapid response investigations, meaning do an investigation by written correspondence. And then if an on-site investigation was opened as a result of an employer's deficient response to the rapid response investigation, then OSHA would open an on-site inspection, but do it virtually to the extent possible. And this is largely driven by the agency's desire to protect its own investigative staff. Next slide, please. But on May 26th, the day after Memorial Day, OSHA authorized area offices as well as state plans to resume regular on-site inspection planning, only in geographic areas where infection rates are on the decline or there is not sustained community transmission. However, they are still instructing area offices to use non-formal phone and fax investigations or the RRI if they've historically done so to address complaints. So the agency is still being cautious about sending its investigative staff out into workplaces to do investigations, and we've seen that even in the case of non-COVID work-related hazards. I mean, traditional or not traditional, but more run-of-the-mill workplace accidents, in the manufacturing setting, which I know some of you may not be involved in, but like amputations or just machine accidents that you have to report to OSHA, where typically an investigator would be on site the next day or that day. We've seen those go uninvestigated, or a rapid response investigation has been used. So it'll be interesting to see how quickly OSHA will actually resume its normal investigative activity, but so far we've seen very little in the way of citations coming out of COVID-related issues. Next slide. So that resume or return to pre-pandemic inspection planning processes is for areas that are seeing a decline in infection rates. But in areas experiencing sustained elevated community transmission or a resurgence of infection rates, area offices are told to continue prioritizing the COVID-19 fatality and imminent danger exposures and paying particular attention to places like hospitals or healthcare providers. Or places with a high number of complaints or known COVID cases. So, for many of you, you're not going to be swept into those groups, but it's also unknown exactly how OSHA is determining if you're in a geographic area experiencing sustained elevated community transmission, because it's a very imprecise process to track the infection rates, including fatalities that are caused by the virus, because the way that coroners and medical staff report these things is not consistent from one jurisdiction to the next. So it's unclear exactly how OSHA is going to administer this policy, but they are trying to return to normal, as many employers out there are. Next slide. So again, this is a continuation of this area. Areas experiencing the sustained community transmission. OSHA is telling this area offices to conduct the remote inspections where possible, use the rapid response investigation, meaning by written correspondence with the employer, and then develop a program to monitor sites that use the RRI to figure out if on-site inspections need to be done later, once things normalize or at a point when they do. So they are instructing the area offices to continue, being sort of hands-off with their investigative activity if you're in areas of community transmission being sustained. And one thing we've yet to see is how the current events surrounding the Black Lives Matter movement and rioting and demonstrations in various urban areas, how that will impact the resurgence of the virus and whether or not we'll see an elevated community transmission. Next slide. So with respect to returning to work, as Sarah talked about, I want to reinforce that communication with employees is absolutely critical. That is one of the biggest drivers that we've seen of employees complaining to OSHA, or even to the police or other agencies or law enforcement that are potentially situated to enforce governor's orders on stay-at-home versus essential industries and when folks can return to work. Employees being in the dark about what's being done to protect them in the workplace is one of the biggest drivers of people complaining to government agencies. So it's important to educate the employees about what you're doing to protect them, protocols that are in place to keep people safe in the workplace, and encourage, an open line of communication with whoever, your point person is in the office, and make sure that if there is a concern, it's voiced internally before, employees, take to their own devices to figure out how to have their concerns be addressed. So, and that, that's the most likely way for OSHA to come knocking on your door is to have an employee complaint, although it would probably be in the form of a letter, as we just discussed. On-site inspection activity is, it remains to be seen how quickly that's going to resume. But if you do have employees coming and talking to you about their concerns, just be cognizant of the potential for, retaliation claims if an adverse personnel decision happens to coincide with the timing of an employee's complaint or concern. That's another area that OSHA does enforce. It's called, their whistleblower investigation unit. If somebody's discharged or disciplined, they can say, it was because I raised health and safety concerns and my employer took action against me because of that. And that's another form of an OSHA investigation that you might have to deal with. So just be cognizant of folks who do come forward with concerns to the extent they, you have another personnel issue with that person that may be running parallel. Next slide. So as you bring folks back, you need to conduct a hazard assessment of your workplace and the different job tasks that are being done to determine what risk level people are potentially exposed to and what necessary precautions you might want to implement as a result of that. And one area is Ppe Selection and providing PPE to employees. That's personal protective equipment. And so keep in mind that if you are requiring face masks, if you're requiring cloth face coverings, or any other form of PPE, then you have to pay for it. The CDC has said that cloth face coverings are not considered PPE, but there's a little bit of a disconnect between OSHA's requirements for PPE and what the CDC is saying. So the CDC just means that a cloth face covering is not necessarily a respirator. It's not going to provide a level of protection that a respirator would for employees, for example, that are in healthcare, who are performing aerosolizing procedures on patients who are potentially positive cases. In that sense, if cloth face covering is not PPE, it's not going to address that hazard. But it is considered by OSHA to be personal protective equipment that will prevent or at least mitigate transmission of the virus in like office settings. And if you're requiring it in your workplace, then it is something that you have to pay for and provide to employees. So that brings us then to what types of masks to use and whether or not to make them voluntary or mandatory. And then that also, those determinations will then have an impact on whether or not you have compliance requirements under OSHA's respiratory protection standard. So if you're using N95s or something more extreme like an elastomeric respirator, which is it's got the rubber seal that goes around your nose and around your chin, and it's got the the cartridges here. It looks like an actual gas mask. That is a respirator. An N95 is also considered a respirator, although it has a lower level of protection. But if you are requiring an N95 or something more, which I'm guessing most of you are not, based on the type of industries you're in, but those would require full compliance with a written respiratory protection program. You'd have to fit test your employees, have to have them medically evaluated to ensure that they're safely able to wear a respirator. But if it's mandatory, or if it's voluntary, if you're just allowing employees to wear them, then there are far fewer compliance requirements under OSHA standards. And if you're using a surgical mask or a dust mask, just like a loose fitting face covering like this, where it's open on the sides and it's not actually sealing around your face, there's no compliance requirements for that. You don't have to have a written respiratory protection program, no medical evaluation. It's much more relaxed from an OSHA standpoint. And you also need to make sure that you're training employees how to properly use PPE, how to clean them, and ensure that the use of a face mask or any other PPE doesn't create some other sort of hazard. And if you do require the use of PPE and people aren't following those requirements, you need to enforce your policies. On the one hand, it can lead to compliance issues if OSHA were ever to come in and see that your people aren't wearing PPE that they should be. It's very difficult to tell OSHA that it was your employees just simply not following your process or your requirements if you don't enforce them. So if you see people not wearing them, you need to have documented written reminders of your policies, and to the extent that non-compliance persists, then disciplinary action may be appropriate. And it's also important to enforce your requirements to instill among folks within your workplace who are concerned that you too are concerned for their health and safety. Because if one person is very worried about the virus and wants everyone else in the office to be wearing masks for their own protection, but an employer is not enforcing their own policies in that regard, then that may lead to unrest among your staff. Next slide, please. And then you also need to think about other administrative or engineering controls that you might put in place to protect your workers, including like social distancing, or to implement social distancing. So whether that's physical barriers, HVAC and ventilation adjustments to circulate air, in the manufacturing setting, which again, I know you're not in many cases, but if you've got fans in the workplace, you need to avoid having air, cross-contaminating employees' separate workspaces. Adjusting traffic patterns, using one-way indications in hallways. Sarah talked about many of these things already, so I don't want to go too much in depth, but you have to figure out ways to keep folks separate in the workplace. It's as simple as that. Next slide. And then if somebody becomes infected, you need to immediately remove them from the workplace, disinfect areas where they worked, and do the pre-diagnosis and symptom contact tracing to figure out who else might be at risk or of exposure as a result of the person's infection. And then, maintain confidentiality, but do provide notice to those folks and decide whether or not they're going to be quarantined as a result. And the CDC is recommending that if somebody is a confirmed case, that you trace back to within 48 hours of when that person became symptomatic. And if anyone was in close contact for a prolonged period of time with that person, meaning within 6 feet, not wearing a mask, and for 15 minutes or more, that's CDC's guidance, then that person, the potentially exposed individual, should be quarantined for 14 days. And then there are ways to bring people out of quarantine. There are a couple different methods that the CDC has recommended, as far as having further testing to make sure that they're not positive after a period of, I think, 7 days, or the person has to be symptom-free for at least 10 days after the first period of exposure. So there are a couple methods the CDC has recommended, depending on whether the person is symptomatic or not. And we can certainly provide you additional guidance on that if you need, if you have a specific case come up that you need assistance with. And then you have to determine whether you have an OSHA record-keeping obligation. So if you are an employer with more than 10 employees and you're not in an exempt low-hazard industry, then you may have an obligation to keep your OSHA 300 log. And if somebody has a confirmed case, meaning they've had a positive test result of a respiratory specimen, then the employer now has to make a reasonable and good faith effort to determine whether or not that infection was work-related. Meaning, is it more likely than not that an exposure in the work environment had a causal connection to the person becoming infected? And OSHA has published new guidance on how to conduct that analysis. And there are several factors that they've laid out to help employers determine whether it is more likely than not that an exposure in the workplace caused the infection. For example, if there are several cases developing in the workplace, like you have a cluster of cases at your office, and the timing of those infections are suggestive that one person passed it to the next, then it's, in that case, it may be more likely that somebody got it at work. But OSHA is also authorizing employers to talk to the employee about their in and out of work activities to determine what level of risk that person might be exposed outside of work. And based on that evidence and the employer's fact finding in the wake of somebody becoming a confirmed case, the employer is left to decide whether it's more likely than not that a workplace exposure may have occurred. And OSHA recognizes that this is a very difficult task for many employers. A lot of employers are not well situated to do this sort of analysis. And so what OSHA is telling its investigative staff is that so long as the employer makes a reasonable and good faith effort to determine whether it was work-related, that's the obligation. So the expectation is OSHA is not going to come in and Monday morning quarterback these decisions, because they're not well situated to do that either, to decide with certainty whether or not somebody was exposed at work. They just want to see that the employee, that that you're thinking about it and making an effort to make that determination. So where compliance risk may arise is if somebody is a confirmed case and you decide not to put it on your 300 log. That would be a situation where it's possible OSHA may issue a citation. They come in and talk to employees and they say, Sally became infected, and then they go look at the log, but Sally's name's not on there. Then that's where you may have a compliance risk. So to the extent that you make that sort of determination, you need to document your effort to determine whether or not the infection was work-related to show OSHA that you did what they asked you to do, which was to at least try. Next slide. And that brings us to the conclusion of our presentation. So if anybody has questions, we are happy to address those now.
Now, we've not had a lot of questions come in. The one that did come in along the way that some of you may have seen was a question about the closure orders from the state and whether some of those orders may be subject to judicial challenge. There is a lot of litigation around that. Some of those may end up being challenged in court successfully, but for present purposes, assume that I operate on the assumption that an order from a state governor or a state health authority like Dr. Amy Acton is valid and is something you've got to comply with. The long-term view on that may result in some changes as far as how those are construed. There are a lot of legislative initiatives underway right now to restrict the authority that some of the state elected officials and appointed officials have to close down businesses. But for present purposes and just going forward, if the state says close it, you close it and you assume that that's what you're required to do, operating in accordance with that until there's actually an order striking down something like that is going to be the safest course. Another question just came in. How do you determine if the HVAC and ventilation system here is actually safe, and is there a certification from an HVAC company that would satisfy this? Connor, do you have any more specific information from the OSHA standpoint about getting any certifications on what your HVAC is doing as far as these ventilation issues go?
Yeah, so neither OSHA nor the CDC has published any specific guidance about what ventilation rates they consider to be safe. But what they're recommending is that you service your equipment, make sure that it is functional, that that air circulation is adequate. So in some cases you may have your building system may be on auto, for example, that if it's at a temperature that is safe or that is within the whatever your thermostat is set, that air won't be moving. And so what they're suggesting is that you use circulation more frequently, unrelated to the temperature setting. But there's been no indication that there's any sort of certification from HVAC contractors that to say that you're compliant. But what we've recommended is that you document that you did recently have the system service. So to the extent that you own your building, it'd probably be a good time to contact your HVAC supplier just to ensure that your system is fully operational. And to the extent that they can set it to have air circulate more frequently, that would be helpful. If you are, if you're leasing your space, contact your landlord and document that process as well, just to show, your good faith and due diligence and trying to, follow OSHA's and CDC's guidance.
And to Connor's comment there, what I'm advising clients is what I'm referring to by way of shorthand as show your work, as far as all of these efforts that you're taking on to try to adjust your workplace. What I mean by that is take pictures, literally have photographic evidence of what you've done to create physical barriers, to reconfigure the workspace, and to comply with the guidance that we're getting from the public health authorities, both on the federal level and on the state level. We will have employees, it's going to come up, I've had some of these calls already this week, with clients saying, I'm hearing from employees who don't feel safe, they don't feel comfortable coming back in, even though we've done all these things. So how do we handle that? One of the points Connor made along the way, there is OSHA retaliation protection if individuals are making complaints in good faith about what they perceive to be a workplace safety issue. That doesn't mean that people can say, I don't feel safe coming back to work, so I'm not going to come back, and there's nothing you can do about it. There certainly are options that you have as management to try to drive that and make sure that people are being held accountable. You may have seen even the state of Ohio and some other states are encouraging employers to report individuals who won't come back to work when there is suitable work available. All of those things align around the same fundamental issue, and that is, what is your narrative as an employer? What evidence and what story can you tell when you are challenged in this way to say, here's what we've done and here's how we've complied with all this guidance to make sure that this workplace, even though none of them can be 100% guaranteed safe with zero risk of contraction, that's not the reality, but that this workplace is in compliance with best practices and we're doing everything we can realistically do. So have that at the ready. Take the pictures before people come in, take pictures of any adjustments you make along the way, have the policies ready to go, all the training issues Sarah mentioned, having people go through a new training regimen to discuss the issues that are new in the return to the office policy and procedure that you've put together on this. Masks are another big issue. This is one where we've had a lot of conversation around this. People are uncomfortable wearing masks. It is awkward, there's no doubt about that, but it is also the state guidance right now in Ohio that in a workplace, unless you're in a private enclosed area working by yourself, you should be wearing a mask as an employee. You've also got the option as an employer, if you're having people come in from the outside, to require that they wear masks. That is not mandatory, but that is an option you have. And again, it is something that is unpopular in a lot of quarters. A lot of people view this as some kind of differentiation point in some cases with where they're going to choose to shop, for example, as some stores are requiring this and others are not. So be aware that those kinds of issues are really going to be the battleground as you go forward, to the extent you have people challenging the requirement to come back and challenging what you've done as management to make sure that the environment is safe.